Question 1. Consider a scenario where a certified paraoptometric assistant CPOA is performing a routine eye examination and notices that the phoropter is consistently providing slightly different refractive measurements for the same eye under identical conditions during multiple readings. The CPOA has followed standard operating procedures for patient positioning and instrument use. What is the most appropriate immediate action for the CPOA to take? Option A. Continue using the phoropter, but make a mental note of the slight variations to account for them during the final prescription determination. Option B. Proceed with the examination using the phoropter, assuming the variations are within an acceptable margin of error for routine testing. Option C. Immediately stop using the phoropter for patient care and report the inconsistency to the supervising optometrist or designated personnel for further evaluation and potential servicing. Option D. Attempt to manually adjust the phoropter's lenses to compensate for the perceived inconsistencies before proceeding with the examination. Correct answer is C. Immediately stop using the phoropter for patient care and report the inconsistency to the supervising optometrist or designated personnel for further evaluation and potential servicing. Explanation. This scenario is professionally challenging because it requires the certified paraoptometric assistant CPOA to balance the immediate need for accurate patient care with the strict adherence to established protocols for instrument calibration and maintenance. Failure to maintain instruments properly can lead to inaccurate diagnostic data, potentially resulting in misdiagnosis or inappropriate treatment plans, which directly impacts patient safety and the quality of care. The CPOA must exercise sound professional judgment to determine the appropriate course of action when faced with a potentially malfunctioning instrument, prioritizing patient well-being and regulatory compliance. The correct approach involves recognizing the potential for error when an instrument's readings are inconsistent, immediately ceasing its use for patient care, and initiating the established protocol for reporting and servicing the equipment. This aligns with the CPOA ethical responsibility to provide competent care and uphold professional standards. Regulatory frameworks for allied health professionals, including paraoptometrics, emphasize the importance of using calibrated and functional equipment for accurate patient assessment. This approach ensures that patient data is reliable and that the practice operates within established quality assurance guidelines, preventing potential harm and maintaining the integrity of diagnostic processes. An incorrect approach of continuing to use the phoropter, despite inconsistent readings, is a significant regulatory and ethical failure. This directly violates the principle of providing competent care, as inaccurate measurements can lead to incorrect prescriptions or treatment decisions. It also breaches the implicit trust patients place in healthcare providers to use reliable tools. Furthermore, it likely contravenes practice guidelines or internal protocols that mandate regular calibration and immediate reporting of equipment malfunctions, potentially exposing the practice to liability and compromising its accreditation or certification status. Another incorrect approach of attempting to recalibrate the phoropter independently without following established protocols or seeking expert assistance is also professionally unacceptable. While well-intentioned, this action bypasses the necessary checks and balances designed to ensure instrument accuracy and safety. It may lead to further damage to the instrument or, more critically, to the generation of misleading data that is then used for patient care. This demonstrates a lack of understanding of the importance of standardized procedures and the specialized knowledge required for instrument maintenance, potentially violating guidelines related to scope of practice and proper equipment management. A professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and acknowledge any deviation from expected instrument performance. 2. Immediately cease using the suspect instrument for patient care to prevent the generation of inaccurate data. 3. Consult and strictly follow the practice's established protocols for reporting equipment malfunctions and initiating service requests. 4. Communicate clearly with the supervising optometrist or relevant personnel about the issue and the steps being taken. 5. Document all observations and actions taken. This structured approach ensures patient safety, regulatory compliance, and the maintenance of high professional standards. Question 2. Compliance review shows a patient is experiencing difficulty adjusting their vision when moving from a brightly lit examination room to a dimly lit hallway. The patient asks the certified paraoptometric assistant CPOA To explain why this happens, which of the following approaches best aligns with the CPOA regulatory framework and scope of practice in educating the patient about the physiology of vision? Option A. Explain that rods are responsible for vision in low light conditions and cones are responsible for vision in bright light and color perception, and that the transition involves the activation and deactivation of these photoreceptor cells. Option B. State that it's a normal part of how eyes work and that they will eventually get used to it, without providing any specific physiological explanation. Option C. Suggests that the patient's difficulty might be due to a developing cataract or a neurological issue, and advise them to schedule a follow-up appointment with the optometrist for further investigation. Option D. Detail the biochemical cascade involving rhodopsin, retinal, and G proteins that occurs when light strikes the photoreceptors, leading to a change in neurotransmitter release. The correct answer is A. Explain that rods are responsible for vision in low light conditions and cones are responsible for vision in bright light and color perception, and that the transition involves the activation and deactivation of these photoreceptor cells. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified paraoptometric assistant, CPOA, to interpret and apply knowledge of visual physiology in a practical patient care context. The challenge lies in accurately explaining complex biological processes to a patient in a way that is understandable, reassuring, and ethically sound, while adhering strictly to the scope of practice defined by CPOA regulations. Misinformation or overstepping professional boundaries can lead to patient anxiety, distrust, and potential regulatory noncompliance. Correct approach analysis. The correct approach involves accurately explaining the roles of rods and cones in light and dark adaptation and color vision, using clear, non-technical language appropriate for a patient. This aligns with the CPOA responsibility to assist the optometrist in patient education and to ensure patients understand their visual conditions and the underlying physiological mechanisms. The regulatory framework for CPOA emphasizes patient education and support within the scope of their training and certification. By focusing on the basic functions of photoreceptors in adapting to different light levels and contributing to color perception, the CPOA acts within their defined role, providing valuable information that enhances patient understanding and compliance with treatment or management plans. This approach respects the patient's right to information and promotes a collaborative patient-provider relationship. Incorrect approaches analysis, an approach that delves into the detailed biochemical cascades of phototransduction, e.g., mentioning rhodopsin, transducin, phosphodiesterase, is incorrect because it exceeds the typical scope of patient education for a CPOA and is likely to be overly technical and confusing for the average patient. While scientifically accurate, it fails to meet the educational objective of clear communication and could lead to patient disengagement or misunderstanding. This over-technicality could be seen as a failure to effectively communicate, a core expectation of patient support roles. Another incorrect approach would be to speculate on potential pathological conditions or to offer diagnostic interpretations related to the patient's visual experience. This directly violates the CPOA scope of practice, which prohibits diagnosis and treatment. The CPOA role is to gather information and assist the optometrist, not to interpret findings or suggest underlying diseases. Such an approach would be a serious regulatory and ethical breach, potentially leading to patient harm and professional disciplinary action. Finally, an approach that dismisses the patient's concerns or provides overly simplistic, inaccurate explanations, e.g., stating that cones only work in bright light and rods only in dim light without nuance, is also incorrect. This demonstrates a lack of understanding of the physiological principles and a failure to provide adequate patient support. It undermines patient confidence and can lead to a perception of inadequate care, potentially impacting the patient's willingness to follow professional advice. Professional reasoning. When faced with a patient inquiry about visual phenomena related to light adaptation or color vision, a CPOA should first acknowledge the patient's question and express willingness to provide information within their scope. The professional should then access their knowledge base regarding the fundamental roles of rods, scotopic vision, low light, motion detection, and cones, photopic vision, color, detail, and how their interplay facilitates adaptation to varying light conditions. The explanation should be tailored to the patient's apparent level of understanding, using analogies if helpful, and focusing on the functional outcomes for the patient, e.g. rods help you see in dim light like at night, and cones help you see colors and fine details when it's bright. If the patient's question hints at a potential underlying condition, the CPOA professional response is to note the observation and inform the optometrist, rather than attempting to explain or diagnose. This systematic approach ensures accurate, patient-centered education that respects regulatory boundaries and ethical obligations. Question 3. Operational review demonstrates a certified paraoptometric assistant CPOA is conducting a subjective refraction. The patient indicates that while one lens provides slightly better clarity, the other feels more comfortable, even if marginally less sharp. The CPOA must decide how to proceed to achieve the best visual outcome for the patient. Option A. Attempt to explain the optical principles behind the difference in clarity and comfort to the patient to help them make a definitive choice. Option B. Make minor adjustments to the lens power based on the patient's feedback, prioritizing a balance between clarity and comfort, and then present the refined prescription for optometrist confirmation. Option C. Disregard the patient's subjective comfort feedback and proceed with the lens that offered the best acuity. Assuming the patient will adapt, Option D. Immediately finalize the prescription based on the lens that provided slightly better clarity, as sharpness is the primary objective in refraction. The correct answer is B. Make minor adjustments to the lens power based on the patient's feedback, prioritizing a balance between clarity and comfort, and then present the refined prescription for optometrist confirmation. Explanation. This scenario presents a professional challenge because it requires the certified paraoptometric assistant, CPOA, to interpret and act upon subjective patient feedback during a subjective refraction, while adhering strictly to established protocols and the scope of practice. The CPOA must balance the patient's perceived visual experience with objective optometric principles and the limitations of their role, ensuring patient safety and accurate refractive outcomes without overstepping professional boundaries. The correct approach involves carefully listening to the patient's subjective responses, making minor adjustments to the lens power based on their feedback, and then confirming the final prescription with the optometrist. This aligns with the CPOA role in assisting with the refractive process, utilizing patient input to refine the prescription within established parameters. Regulatory frameworks for CPOA emphasize assisting the optometrist in gathering patient data, which includes subjective responses. Ethical guidelines also mandate acting in the patient's best interest, which means striving for the clearest and most comfortable vision possible within the scope of their duties. An incorrect approach would be to unilaterally change the prescription based solely on the patient's initial, potentially unrefined, subjective preference without further verification or consultation with the optometrist. This could lead to an inaccurate prescription, potentially causing visual discomfort or even harm. Such an action would violate the CPOA scope of practice, which typically requires optometrist oversight for final prescription decisions. Another incorrect approach would be to dismiss the patient's subjective feedback entirely and proceed with the current lens power without attempting to accommodate their concerns. This fails to uphold the ethical obligation to provide patient-centered care and could result in patient dissatisfaction and a suboptimal visual outcome. Finally, attempting to explain complex optical principles or the rationale behind specific lens choices to the patient in detail would exceed the CPOA-defined role and could lead to confusion or misinterpretation, potentially undermining the optometrist's authority and the patient's trust. Professionals should approach such situations by first acknowledging and validating the patient's subjective experience. They should then apply their knowledge of refraction techniques to make incremental adjustments, seeking to optimize the visual acuity and comfort. Crucially, they must recognize the boundaries of their practice, ensuring that any proposed final prescription is reviewed and approved by the supervising optometrist. This systematic process, grounded in patient care, professional scope, and collaborative practice, ensures both accuracy and ethical conduct. Question 4. Strategic planning requires a paraoptometric assistant to understand the clinical significance of each ocular component in relation to vision and eye health. Considering the direct impact on a patient's ability to perform daily visual tasks, which ocular component's dysfunction would most likely lead to severe and persistent visual impairment that cannot be fully corrected by standard refractive lenses. Option A, the sclera. Option B, the eyelid. Option C, the conjunctiva. Option D, the cornea. The correct answer is D, the cornea. Explanation. This scenario is professionally challenging because it requires a paraoptometric assistant to synthesize information about the clinical significance of various ocular components and their impact on vision and eye health, directly relating it to patient care and potential interventions. The challenge lies in accurately identifying which components' dysfunction would most significantly impair a patient's ability to perform daily visual tasks, necessitating a deep understanding beyond basic anatomy. Careful judgment is required to prioritize the impact of different ocular structures on functional vision. The correct approach involves recognizing that the cornea's primary role in light refraction is fundamental to clear vision. Significant corneal pathology, such as severe astigmatism, opacities, or scarring, directly distorts the incoming light, leading to blurred vision, diplopia, and reduced visual acuity that cannot be fully corrected by lenses alone. This directly impacts a patient's ability to engage in activities like reading, driving, and recognizing faces, making it a critical component for overall visual function and quality of life. This aligns with the CPOA scope of practice, which includes assisting in patient care and understanding the implications of ocular conditions on vision. An incorrect approach would be to focus on the conjunctiva. While conjunctivitis can cause discomfort and temporary blurriness due to discharge or inflammation, it typically does not cause permanent or severe visual impairment that fundamentally alters a patient's ability to function visually in the long term. Assuming prompt treatment, its impact is generally transient and less structurally significant to the refractive process compared to the cornea. Another incorrect approach would be to prioritize the sclera. The sclera, the white outer layer of the eye, provides structural support but plays a minimal direct role in the refractive process or image formation. While diseases affecting the sclera can be serious, their direct impact on visual acuity and functional vision is usually secondary or related to complications rather than the sclera's inherent function in vision. Finally, an incorrect approach would be to focus on the eyelid. Eyelid issues can cause discomfort, affect tear film distribution, and lead to some visual obstruction, e.g., ptosis, but they do not fundamentally alter the eye's ability to focus light onto the retina in the same way that corneal irregularities do. Their impact on vision is often mechanical or related to surface lubrication rather than the core refractive power of the eye. Professionals should employ a decision-making framework that prioritizes ocular components based on their direct contribution to the visual pathway and the severity of functional impairment caused by their dysfunction. This involves understanding the refractive elements of the eye cornea, lens, the light-sensing elements, retina, and the neural pathways, and then assessing how pathology in each area would most significantly impact a patient's ability to see and perform daily tasks. Question 5. Benchmark analysis indicates that a patient presents with a noticeable difficulty in moving their right eye outward, away from the nose, when asked to look to the extreme left. Which extraocular muscle's function is most directly implicated by this observation, and what is the paraoptometric assistant's primary responsibility in this situation? Option A. The superior oblique muscle is implicated, and the paraoptometric assistant should proceed with testing visual acuity in the affected eye. Option B. The inferior rectus muscle is implicated, and the paraoptometric assistant should suggest eye exercises to the patient. Option C. The lateral rectus muscle is implicated, and the paraoptometric assistant's responsibility is to accurately document the limitation in abduction and report it to the optometrist. Option D. The medial rectus muscle is implicated, and the paraoptometric assistant should reassure the patient that this is a common finding. The correct answer is C. The lateral rectus muscle is implicated, and the paraoptometric assistant's responsibility is to accurately document the limitation in abduction and report it to the optometrist. Explanation: this scenario is professionally challenging because it requires a paraoptometric assistant to interpret and act upon subtle clinical findings related to extraocular muscle function. Misinterpretation or improper management can lead to delayed diagnosis, patient discomfort, or progression of underlying conditions. The CPOA role is to assist the optometrist, and understanding the implications of specific muscle deficits is crucial for effective patient care and communication within the scope of practice. The correct approach involves recognizing that a limitation in the outward movement of the eye, particularly when looking to the side, directly implicates the lateral rectus muscle. This muscle is responsible for abduction, turning the eye outward. A deficit in its function would manifest as difficulty or inability to move the eye away from the nose. The CPOA responsibility is to accurately document these findings and communicate them to the supervising optometrist for further evaluation and diagnosis. This aligns with the CPOA scope of practice, which includes assisting in patient examination and data collection, and adhering to the ethical principle of accurate reporting and patient advocacy. An incorrect approach would be to assume the limitation is due to a different muscle group. For instance, attributing the outward movement limitation to the medial rectus muscle would be incorrect because the medial rectus is responsible for adduction, turning the eye inward. Similarly, attributing it to the superior or inferior rectus muscles is incorrect as these primarily control vertical eye movements. Attributing it to the oblique muscles would also be incorrect, as they primarily contribute to torsional movements and some vertical movement depending on the eye's position. Each of these incorrect assumptions represents a failure to accurately assess and document clinical findings, potentially leading to miscommunication with the optometrist and inappropriate patient management, violating the ethical duty of competence and diligence. Professionals should approach such situations by systematically evaluating eye movements in all cardinal directions. When a limitation is observed, they should consider the primary action of each extraocular muscle and its corresponding direction of movement. Documenting the specific limitation, e.g., limited abduction in the left eye, and the direction of gaze where it occurs is paramount. This detailed observation, coupled with clear communication to the supervising optometrist, forms the basis for accurate diagnosis and treatment planning, ensuring patient safety and optimal care within the CPOA-defined responsibilities. Question 6. The efficiency study reveals that a patient undergoing a routine eye examination reports seeing shimmering, rainbow-like halos around lights, particularly in dim conditions. The CPOA observes that the examination room lighting is standard fluorescent. The patient denies any recent injury or significant change in their medical history. The CPOA must determine the most appropriate initial interpretation and action based on the principles of light. Option A. Recognize that the patient's description is consistent with the optical phenomena of refraction and diffraction, which can be influenced by changes in the eye's optical media, and accurately document this observation for the optometrist. Option B. Conclude that the patient is likely experiencing a subjective visual disturbance unrelated to any significant ocular pathology, possibly due to the specific type of fluorescent lighting. Option C. Suggests that the patient simply needs to adjust their eyes to the lighting and that no further investigation is necessary. Option D. Immediately advise the patient that they are likely developing a cataract and recommend they schedule a surgical consultation. The correct answer is A. Recognize that the patient's description is consistent with the optical phenomena of refraction and diffraction, which can be influenced by changes in the eye's optical media, and accurately document this observation for the optometrist. Explanation. This scenario presents a professional challenge because it requires a certified paraoptometric assistant, CPOA, to apply fundamental principles of light to a practical patient care situation, ensuring accurate assessment and appropriate intervention within the scope of their practice. The CPOA must demonstrate a nuanced understanding of how light behaves to interpret visual phenomena and communicate effectively with the supervising optometrist. Careful judgment is required to distinguish between normal optical effects and potential indicators of underlying ocular conditions. The correct approach involves recognizing that the observed shimmering or rainbow-like colors around lights are likely due to the principles of light refraction and diffraction. Refraction, the bending of light as it passes through different mediums, can be altered by changes in the cornea or lens. Diffraction, the bending of light waves around obstacles, can also contribute to visual distortions. Understanding these principles allows the CPOA to accurately describe the patient's subjective experience to the optometrist, facilitating a proper diagnosis. This aligns with the CPOA ethical responsibility to provide accurate patient information and support the optometrist's diagnostic process, adhering to the standards of care expected within the optometric profession. An incorrect approach would be to dismiss the patient's observations as insignificant or solely attributable to ambient lighting conditions, without considering the underlying optical principles. This failure to investigate further could lead to a misdiagnosis of conditions like corneal edema, early cataracts, or other refractive anomalies that manifest as halos or colored rings around lights. Ethically, this demonstrates a lack of diligence and a failure to uphold the standard of care. Another incorrect approach would be to offer a definitive diagnosis or treatment recommendation based on the observed symptoms. As a CPOA, providing medical diagnoses or prescribing treatments falls outside the defined scope of practice. Doing so would violate regulatory guidelines and ethical boundaries, potentially harming the patient and undermining the authority of the supervising optometrist. A third incorrect approach would be to focus solely on the patient's subjective report without attempting to correlate it with objective findings or the principles of light. While patient perception is crucial, a professional must also consider the physical phenomena at play. Ignoring the optical principles means missing a key diagnostic clue. The professional reasoning process for similar situations should involve a systematic approach. First, actively listen to and document the patient's subjective complaints. Second, consider the underlying scientific principles, in this case, principles of light, that might explain the reported phenomena. Third, perform appropriate objective tests within the CPOA scope of practice to gather data. Fourth, accurately and concisely communicate all findings, both subjective and objective, to the supervising optometrist, highlighting any potential correlations with optical principles. Finally, await the optometrist's diagnosis and treatment plan. Question 7. Market research demonstrates that patients often present with vague complaints that can be related to the complex anatomy of the orbit. A patient reports a sensation of something gritty in their eye, accompanied by mild redness and intermittent tearing, which has been present for 3 days. The patient denies any recent trauma, sudden vision changes, or severe pain. Considering the bony orbit, orbital contents, eyelids, conjunctiva, and lacrimal system, which of the following represents the most appropriate initial risk assessment and management approach for a certified paraoptometric assistant, CPOA? Option A. Perform a comprehensive visual acuity test. Assess the eyelids for signs of inflammation or debris, examine the conjunctiva for injection or discharge, and evaluate the lacrimal puncta for patency. Based on findings, recommend artificial tears and warm compresses if signs of dry eye or mild blepharitis are present, and schedule a follow-up if symptoms persist or worsen. Option B. Focus solely on the bony orbit, assuming the gritty sensation is referred pain from a potential sinus issue, and recommend nasal decongestants. Option C. Advise the patient to use over-the-counter antibiotic eye drops, as the symptoms strongly suggest a bacterial conjunctivitis that needs prompt treatment to prevent spread. Option D. Immediately refer the patient to the supervising optometrist or ophthalmologist, explaining that any foreign body sensation requires immediate physician evaluation to rule out serious orbital pathology. The correct answer is A. Perform a comprehensive visual acuity test, assess the eyelids for signs of inflammation or debris, examine the conjunctiva for injection or discharge, and evaluate the lacrimal puncta for patency. Based on findings, recommend artificial tears and warm compresses if signs of dry eye or mild blepharitis are present, and schedule a follow-up if symptoms persist or worsen. Explanation: this scenario is professionally challenging because it requires the certified paraoptometric assistant, CPOA, to interpret patient-reported symptoms related to orbital anatomy and determine the appropriate course of action within their scope of practice, adhering strictly to CPOA regulations. Misinterpreting symptoms or overstepping boundaries could lead to delayed diagnosis, improper treatment, or patient harm, all of which carry significant regulatory and ethical implications. Careful judgment is required to differentiate between common, benign conditions and those requiring immediate physician referral. The correct approach involves a systematic assessment of the patient's reported symptoms, correlating them with potential anatomical structures of the orbit, and then making a decision based on established CPOA protocols and scope of practice guidelines. This approach is right because it prioritizes patient safety and efficient care delivery. Specifically, it involves recognizing symptoms that fall within the CPOA diagnostic and management capabilities, e.g., identifying signs of dry eye or blepharitis, and those that necessitate immediate referral to the supervising optometrist or ophthalmologist, e.g., sudden vision loss, severe orbital pain, proptosis. This aligns with the CPOA role as an assistant, ensuring that complex or potentially serious conditions are handled by a licensed eye care professional, thereby fulfilling regulatory requirements for patient care and professional conduct. An incorrect approach would be to immediately assume a specific diagnosis without a thorough symptom assessment and comparison to known orbital pathologies. This is a regulatory failure because it bypasses the necessary diagnostic steps and could lead to misdiagnosis. Another incorrect approach is to provide treatment recommendations for symptoms that clearly indicate a need for physician evaluation, such as significant pain or visual disturbance. This is an ethical and regulatory failure, as it constitutes practicing beyond the CPOA-defined scope of practice, potentially causing harm and violating patient trust. Finally, dismissing the patient's symptoms as minor without proper evaluation is also an incorrect approach, representing a failure in professional diligence and potentially delaying critical care, which is a breach of ethical and regulatory standards. Professional decision-making in similar situations should involve a clear understanding of the CPOA scope of practice, including what conditions can be assessed and managed, and what symptoms mandate immediate referral. A structured approach, starting with active listening to the patient, followed by a focused history and relevant physical assessment within CPOA capabilities, and then a clear decision tree for referral or management, is crucial. This framework ensures that patient care is both efficient and safe, always prioritizing the patient's well-being and adhering to all applicable regulations. Question 8. Quality control measures reveal that during a routine visual acuity test, a patient exhibits a sluggish pupillary light reflex in the left eye and reports difficulty with near focusing. The certified paraoptometric assistant CPOA has confirmed the sluggish reflex and noted the patient's subjective complaint. What is the most appropriate immediate action for the CPOA? Option A. Record the findings and wait for the optometrist to ask about the patient's subjective complaints during the examination. Option B. Document the findings accurately and immediately report them to the supervising optometrist. Option C. Advise the patient that the difficulty with near focusing is likely due to age and the pupillary reflex is within normal limits. Option D. Perform additional diagnostic tests for accommodation and pupillary function without consulting the optometrist. The correct answer is B. Document the findings accurately and immediately report them to the supervising optometrist. Explanation. Scenario analysis. This scenario presents a challenge in accurately assessing a patient's neurological status related to vision. A paraoptometric assistant must recognize the limitations of their scope of practice while ensuring patient safety and appropriate referral. Misinterpreting or failing to recognize signs related to cranial nerve dysfunction can lead to delayed diagnosis and treatment, potentially impacting the patient's vision and overall health. The assistant must balance providing essential patient care with understanding when to escalate concerns to the supervising optometrist. Correct approach analysis. The correct approach involves recognizing the potential significance of the observed pupillary light reflex asymmetry and accommodation difficulty. This indicates a possible issue with cranial nerves Roman 2 optic nerve, afferent pathway, Roman 3 oculomotor nerve, efferent pathway, or the autonomic pathways controlling pupillary response. Accommodation involves cranial nerve Roman 3. Given the CPOA scope of practice, which includes assisting with diagnostic testing and patient care under supervision, the most appropriate action is to document the findings accurately and immediately report them to the supervising optometrist. This ensures that a qualified professional can perform a comprehensive neuro-ophthalmic examination and determine the underlying cause, adhering to the principle of patient safety and professional responsibility as outlined by CPOA guidelines, which emphasize reporting significant clinical findings. Incorrect approaches analysis. Failing to document and report the findings to the optometrist is a failure to adhere to professional responsibility and patient care standards. It risks overlooking a potentially serious condition, violating the CPOA duty to assist in diagnosis and patient management. Attempting to independently diagnose the cause of the pupillary asymmetry and accommodation issue exceeds the CPOA scope of practice. This could lead to misdiagnosis, inappropriate patient advice, and potential harm, violating ethical guidelines that prohibit practicing beyond one's authorized competency. Dismissing the findings as insignificant without proper evaluation by the optometrist is a critical error. It demonstrates a lack of clinical judgment and a failure to recognize potential signs of neuro-ophthalmic compromise, which could have serious consequences for the patient's vision and health. Professional reasoning. When faced with findings that suggest potential neurological involvement affecting vision, a paraoptometric assistant should follow a systematic approach. 1. Observe and accurately document all relevant findings, including objective measurements and subjective patient reports. 2. Immediately communicate these findings to the supervising optometrist, highlighting any concerning aspects. 3. Await further instructions from the optometrist regarding additional testing or patient management. This process ensures that patient care is delivered within the established scope of practice, prioritizes patient safety, and facilitates timely and accurate diagnosis by the licensed practitioner. Question 9. The audit findings indicate a patient presence with a palpable, firm mass noted in the superior temporal quadrant of the orbit during a routine visual acuity test. The patient also reports intermittent blurred vision in that eye, which has been present for approximately 2 weeks. What is the most appropriate clinical action for a certified paraoptometric assistant to take in this situation? Option A. Document the mass's characteristics and associated symptoms, and immediately report these findings to the supervising optometrist for further evaluation. Option B. Advise the patient that this is likely a benign cyst and recommend warm compresses at home. Option C. Reassure the patient that the blurred vision is unrelated to the palpable mass and proceed with the remainder of the eye exam. Option D. Measure the mass precisely and schedule a follow-up appointment in 3 months to monitor its growth. Correct answer is A. Document the mass's characteristics and associated symptoms, and immediately report these findings to the supervising optometrist for further evaluation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a paraoptometric assistant to interpret clinical findings related to orbital anatomy and assess their potential impact on vision and eye health. The challenge lies in distinguishing between normal anatomical variations and pathological conditions that necessitate immediate referral or further investigation, all while adhering to the scope of practice defined by CPOA regulations. Accurate assessment is crucial to prevent delays in diagnosis and treatment, which could lead to irreversible vision loss or other serious complications. Correct approach analysis. The correct approach involves recognizing that a palpable mass or swelling in the orbital region, particularly when associated with visual disturbances or pain, is a significant clinical finding. This approach aligns with the CPOA emphasis on patient safety and the assistant's role in identifying and reporting potential health concerns. Specifically, the CPOA framework mandates that assistants observe and report changes in a patient's condition, and this includes recognizing signs that may indicate orbital pathology. The correct approach prioritizes patient well-being by ensuring that such findings are promptly communicated to the supervising optometrist for a comprehensive examination and diagnosis, thereby adhering to the ethical obligation of patient care and the regulatory requirement to act within one's scope of practice. Incorrect approach is analysis. An approach that dismisses the palpable mass as a benign anatomical variation without further assessment is incorrect because it fails to acknowledge the potential for malignancy or other serious orbital diseases. This oversight could lead to a misdiagnosis and delayed treatment, violating the ethical duty to provide competent care and potentially contravening CPOA guidelines on patient observation and reporting. An approach that focuses solely on documenting the size of the mass without considering its location, consistency, or any associated symptoms is also incorrect. While measurement is part of assessment, it is insufficient on its own. The clinical significance of an orbital mass is determined by a constellation of factors, and neglecting these can lead to an incomplete picture and a failure to recognize the urgency of the situation, which is a breach of professional responsibility. An approach that suggests immediate self-treatment or advising the patient on home remedies without consulting the supervising optometrist is fundamentally flawed and outside the scope of practice for a certified paraoptometric assistant. This constitutes practicing optometry without a license and poses a significant risk to the patient's health, directly violating CPOA regulations and ethical standards. Professional reasoning. When faced with a palpable mass or swelling in the orbital region, a paraoptometric assistant should follow a systematic process. 1. Observe and document all relevant findings, including the location, size, consistency, mobility, and any associated symptoms such as pain, vision changes, or restricted eye movements. 2. Immediately report these findings to the supervising optometrist, highlighting any concerning characteristics. 3. Await further instructions from the optometrist regarding examination, diagnostic tests, or referral. This structured approach ensures that all necessary information is gathered, communicated effectively, and that patient care remains within the established regulatory and ethical boundaries. Question 10. The efficiency study reveals that the autorefractor consistently provides refractive error measurements within a few minutes, significantly reducing patient wait times. However, a subset of patients exhibit readings that are borderline or inconsistent with their reported visual symptoms. In such cases, what is the most appropriate course of action for a certified paraoptometric assistant (CPOA) to ensure the highest standard of patient care and diagnostic accuracy as per CPOA guidelines? Option A. Advise the patient to return at a later date for a re-evaluation of their refractive error, deferring the decision to the optometrist. Option B. Utilize retinoscopy to objectively confirm or refine the refractive error measurement when autorefractor readings are questionable or inconsistent with patient symptoms. Option C. Proceed with the autorefractor reading as the definitive measurement, prioritizing efficiency and reduced patient wait times. Option D. Perform a manual refraction based on the autorefractor's initial reading, without further objective verification. The correct answer is C. Proceed with the autorefractor reading as the definitive measurement, prioritizing efficiency and reduced patient wait times. Explanation. This scenario presents a professional challenge because it requires a paraoptometric assistant to balance the need for efficiency with the absolute priority of accurate patient care. As mandated by the Certified Paraoptometric Assistant (CPOA) regulatory framework, the CPOA guidelines emphasize that while time-saving methods are valuable, they must never compromise the integrity of diagnostic procedures or patient safety. The core of the challenge lies in determining when a preliminary measurement, such as autorefraction, is sufficient, and when a more definitive method like retinoscopy is ethically and regulatorily required. The correct approach involves recognizing that autorefraction provides a valuable initial estimate, but is subject to various limitations, including patient cooperation, accommodation, and optical aberrations. The CPOA framework implicitly requires that all diagnostic measurements be as accurate and reliable as possible to ensure appropriate treatment. Therefore, when there is any doubt about the autorefractor's reading, or when the patient's refractive error is complex or potentially unstable, performing retinoscopy is the ethically and regulatorily sound choice. Retinoscopy, when performed correctly, offers a more objective and precise measurement, reducing the risk of misdiagnosis and subsequent inappropriate prescription. This aligns with the CPOA commitment to upholding the highest standards of patient care and professional competence. An incorrect approach would be to solely rely on the autorefractor's reading without considering its limitations or the patient's specific circumstances. This failure to perform a confirmatory or more definitive measurement when indicated would violate the CPOA implicit duty to ensure diagnostic accuracy. It could lead to an inaccurate prescription, potentially causing patient discomfort, visual impairment, and dissatisfaction, which are all professional failures. Another incorrect approach would be to dismiss the autorefractor's reading without a systematic attempt to reevaluate it or consider alternative objective measurements. This demonstrates a lack of diligence and a failure to exhaust all reasonable diagnostic avenues, which is contrary to the professional standards expected of a CPOA. Professionals should employ a decision-making framework that prioritizes patient welfare and diagnostic accuracy. This involves 1. Understanding the capabilities and limitations of each diagnostic tool, autorefractor vs. retinoscopy. 2. Assessing the patient's condition and cooperation during the initial measurement. 3. Recognizing indicators of potential inaccuracy in the autorefractor reading, e.g., high cylinder, inconsistent readings, patient discomfort. And 4. Applying clinical judgment to determine if a more definitive measurement, such as retinoscopy, is necessary to ensure the accuracy of the refractive assessment, thereby adhering to CPOA standards. Question 11. Market research demonstrates that patients experiencing sudden or progressive vision loss often report specific patterns of visual field deficits. A patient presents with a complaint of difficulty seeing objects in their left visual field, consistently across both eyes. Based on your understanding of the visual pathway, which anatomical location is most likely to be affected by a lesion causing this type of homonymous visual field defect? Option A, the optic nerve. Option B, the optic chiasm. Option C, the retina. Option D, the optic tracts. The correct answer is B, the optic chiasm. Explanation. This scenario is professionally challenging because it requires a paraoptometric assistant to interpret and act upon information related to a patient's visual pathway, which directly impacts their ability to perform daily tasks and potentially indicates serious underlying neurological or ocular conditions. The CPOA role is to assist the optometrist, and understanding the implications of visual field defects is crucial for accurate patient care and efficient practice operations. Careful judgment is required to ensure that patient information is handled appropriately and that any observed abnormalities are communicated effectively to the supervising optometrist. The correct approach involves recognizing that a reported visual field defect, such as hemianopsia, suggests a lesion affecting a specific part of the visual pathway. Understanding that the optic chiasm is where fibers from the nasal retina of each eye cross over, a lesion here would typically result in bitemporal hemianopsia. If the defect is homonymous, affecting the same side of the visual field in both eyes, it points to a lesion posterior to the chiasm, in the optic tracts, lateral geniculate nucleus, or visual cortex. The CPOA responsibility is to accurately document the patient's reported symptoms and the optometrist's findings, and to understand the potential anatomical locations of the visual pathway that could be affected, thereby facilitating the optometrist's diagnosis and management plan. This aligns with the CPOA scope of practice, which includes assisting in patient care and understanding basic visual science principles relevant to optometric practice. An incorrect approach would be to dismiss the reported visual field defect as insignificant or to attempt to diagnose the specific cause of the defect without the optometrist's direct supervision and expertise. This failure to recognize the potential severity and anatomical implications of a visual field defect violates the ethical duty to provide competent patient care and could lead to delayed diagnosis and treatment. Another incorrect approach would be to overstep the scope of practice by providing a definitive diagnosis or treatment recommendation, which is solely the responsibility of the licensed optometrist. This would be a violation of regulatory guidelines regarding the scope of practice for paraoptometric assistance. The professional decision-making process for similar situations involves a systematic approach. First, accurately gather and document all patient information and findings. Second, apply knowledge of the visual pathway to understand the potential implications of the observed or reported symptoms. Third, communicate clearly and concisely with the supervising optometrist, highlighting any significant findings or concerns. Finally, adhere strictly to the established scope of practice and ethical guidelines, ensuring patient safety and well-being are paramount. Question 12. Risk assessment procedures indicate that a patient is exhibiting some apprehension when asked to participate in a pupillary light reflex test and a near response test. The patient states, "I don't really want you to shine that light in my eyes, and I don't know why you need to check if my pupils get smaller when I look at something close." As a certified paraoptometric assistant, what is the most appropriate course of action? Option A. Stop the examination and inform the patient that if they are unwilling to cooperate with standard diagnostic procedures, they may need to reschedule their appointment. Option B. Pause the examination, clearly and simply explain the purpose of the pupillary light reflex test and the near response test, and ask the patient if they have any questions before proceeding. Option C. Immediately proceed with the pupillary light reflex test and near response test, reassuring the patient that these are quick and routine procedures that do not require detailed explanation. Option D. Gently explain that these are standard tests to check the health of the optic nerve and brain function, and that it is important for their eye health assessment. Then proceed with the tests after a brief pause. The correct answer is D. Gently explain that these are standard tests to check the health of the optic nerve and brain function, and that it is important for their eye health assessment. Then proceed with the tests after a brief pause. Explanation. This scenario presents a professional challenge because it requires the certified paraoptometric assistant, CPOA, to balance the immediate need for accurate patient care with the ethical obligation to respect patient autonomy and privacy, particularly when a patient may not fully understand the implications of their choices. The CPOA must navigate a situation where a patient's stated preference might conflict with what appears to be medically indicated, necessitating a careful and ethical response. The correct approach involves clearly and concisely explaining the purpose of the pupillary light reflex test and the near response test to the patient, ensuring they understand what is being done and why. This approach respects patient autonomy by providing them with the necessary information to give informed consent, even for routine procedures. It aligns with ethical guidelines that mandate clear communication and patient education. By explaining the tests, the CPOA empowers the patient to make an informed decision about proceeding, fostering trust and upholding professional standards of care. An incorrect approach would be to proceed with the tests without adequate explanation, assuming the patient understands, or that it is a routine procedure not requiring explicit consent beyond initial check-in. This fails to uphold the ethical principle of informed consent, potentially leading to patient anxiety or distrust if they feel procedures were performed without their full understanding. Another incorrect approach would be to dismiss the patient's discomfort or hesitation and proceed forcefully. This disregards patient autonomy and can be perceived as unprofessional and coercive, violating ethical standards of patient respect and dignity. Finally, a failure to document the patient's concerns or the explanation provided could also be an ethical lapse, as it leaves a gap in the patient's record regarding their understanding and consent for the examination. Professionals should approach such situations by prioritizing clear patient-centered communication. The decision-making process involves 1. Assessing the patient's apparent understanding and comfort level. 2. Providing a simple, jargon-free explanation of the procedure and its purpose. 3. Actively seeking the patient's verbal confirmation of understanding and willingness to proceed. 4. Respecting the patient's right to refuse or ask further questions. 5. Documenting the interaction, including the explanation given and the patient's response. Question 13. The evaluation methodology shows a patient presenting with a complaint of difficulty distinguishing between shades of red and green, particularly in dim lighting conditions. The Certified Paraoptometric Assistant, CPOA, is reviewing the results of various visual function tests. Which of the following explanations most accurately reflects the detailed mechanisms of light detection and processing relevant to this patient's presentation within the scope of CPOA responsibilities? Option A. The patient's symptoms suggest a potential issue with the cone photoreceptors, specifically the S cones, which are most sensitive to blue light and are crucial for color discrimination. Option B. The patient's presentation indicates a problem with the transduction of light into electrical signals by the rods and cones, likely affecting the photopigment cycle and the amplification cascade. Option C. The patient's difficulty is primarily due to a deficiency in the photopigment rhodopsin, which is responsible for scotopic vision and is less sensitive to color. Option D. The patient's difficulty is most likely related to the processing of visual information in the occipital lobe of the brain, impacting the interpretation of color signals. The correct answer is C. The patient's difficulty is primarily due to a deficiency in the photopigment rhodopsin, which is responsible for scotopic vision and is less sensitive to color. Explanation. The evaluation methodology shows a scenario where a certified paraoptometric assistant, CPOA, must interpret and act upon patient data related to light detection and processing. This is professionally challenging because the CPOA is expected to understand the underlying physiological mechanisms to accurately assess the patient's condition and communicate findings appropriately, while adhering strictly to the scope of practice defined by regulatory bodies. Misinterpreting these complex processes can lead to incorrect patient management, delayed diagnosis, or inappropriate referrals, all of which have significant ethical and regulatory implications. The correct approach involves accurately identifying the specific photoreceptor cells, rods and cones, responsible for different aspects of vision, scotopic and photopic vision, color perception, and understanding how their signals are transduced and transmitted through the retina and optic nerve to the visual cortex. This requires a foundational knowledge of the photopigment cycle, signal amplification, and neural pathways involved in light processing. Regulatory frameworks for CPOA emphasize the importance of accurate data interpretation and the limitations of their scope of practice, requiring them to recognize when a situation necessitates referral to a higher-level practitioner. An incorrect approach would be to oversimplify the process, focusing only on the gross outcome of vision, without considering the cellular and biochemical mechanisms of light detection. For instance, attributing all light detection solely to the eye, without differentiating the roles of rods and cones, or failing to recognize the distinct processing pathways for different light intensities and wavelengths, demonstrates a lack of understanding of the detailed mechanisms. This superficial understanding could lead to misinterpreting test results that specifically probe these mechanisms, such as those assessing dark adaptation or color vision deficits. Ethically, this failure to grasp the fundamental science behind visual function violates the duty to provide competent care. Regulatory failure occurs when the CPOA actions or interpretations fall outside the expected standard of knowledge and practice for their certification level, potentially leading to patient harm or misdiagnosis. Another incorrect approach would be to confuse the mechanisms of light detection with the processing of visual information in the brain. While the brain is crucial for interpreting visual stimuli, the CPOA role is primarily focused on the initial detection and transduction of light by the ocular structures and the immediate neural pathways. Misattributing higher-level cognitive visual processing to the CPOA direct diagnostic responsibilities would be a scope of practice violation. This demonstrates a misunderstanding of the sequential nature of visual processing and the specific domain of the CPOA. A third incorrect approach would be to rely on anecdotal evidence or generalized assumptions about vision rather than applying established scientific principles of phototransduction. For example, assuming that any difficulty seeing in dim light is simply bad night vision, without considering the specific roles of rod function and the photopigment regeneration cycle, would be a failure to apply detailed knowledge. This lack of precise understanding can lead to inaccurate assessments and inappropriate recommendations, contravening the regulatory requirement for evidence-based practice. The professional decision-making process for similar situations requires a systematic approach. First, clearly identify the patient's reported symptoms and the objective findings from diagnostic tests. Second, access and apply the foundational scientific knowledge relevant to the observed phenomena, specifically focusing on the detailed mechanisms of light detection and processing as defined within the CPOA scope of practice. Third, critically evaluate whether the findings in the patient's condition fall within the CPOA authorized responsibilities for assessment and management. Finally, if the situation requires interpretation beyond the CPOA expertise or scope, initiate the appropriate referral process to a licensed optometrist or ophthalmologist, ensuring clear and accurate communication of all gathered data. Question 14. The evaluation methodology shows a patient inquiring about the presence of prisms in their new eyeglass prescription. Which of the following explanations best aligns with the CPOA role in patient education regarding prism effects? Option A. Detail the complex optical principles of light refraction and Snell's law as they apply to prism diopters and their impact on the visual pathway. Option B. Explain that prisms are incorporated to redirect light, helping to align the images seen by each eye and alleviate symptoms like double vision or eye strain, thereby enhancing visual comfort. Option C. Suggest that the prisms are likely a sign of a significant underlying eye condition that requires further investigation by the optometrist. Option D. Inform the patient that prisms are a standard component in some prescriptions to correct for specific visual anomalies without further elaboration. The correct answer is B. Explain that prisms are incorporated to redirect light, helping to align the images seen by each eye and alleviate symptoms like double vision or eye strain, thereby enhancing visual comfort. Explanation. This scenario is professionally challenging because it requires the certified Paraoptometric assistant CPOA to interpret and communicate complex optical principles related to prism effects to a patient, ensuring understanding without causing undue alarm or confusion. The CPOA must balance the need for accurate information with patient comprehension and comfort, adhering to professional standards of care and communication. The correct approach involves clearly explaining to the patient that prisms in their lenses are designed to redirect light, thereby compensating for eye alignment issues that might cause double vision or eye strain. This explanation should focus on the functional benefit of the prism, such as improving visual comfort and clarity, without delving into overly technical jargon or implying a serious underlying pathology unless specifically indicated by the optometrist. This aligns with the CPOA role in patient education and support, as outlined by professional guidelines that emphasize clear, understandable communication regarding prescribed optical aids. The focus is on the therapeutic effect and patient benefit, which is a core responsibility. An incorrect approach would be to simply state that the lenses have prisms without further explanation, leaving the patient to speculate about their purpose and potential implications. This failure to educate violates the principle of informed patient care and can lead to anxiety, Another incorrect approach would be to over-explain the physics of light refraction through prisms in a way that is overly technical and confusing for the patient. This demonstrates a lack of patient-centered communication and can undermine trust. Finally, implying that the prisms indicate a severe or progressive eye condition without explicit direction from the optometrist is a significant ethical and professional breach, potentially causing unnecessary distress and exceeding the CPOA scope of practice. Professionals should approach such situations by first understanding the optometrist's prescription and the intended purpose of the prism. They should then consider the patient's likely level of understanding and tailor their explanation accordingly, using analogies or simple terms to describe the prism's function. The goal is to empower the patient with knowledge about their eyewear and its benefits, fostering a positive patient-provider relationship. Question 15. Stakeholder feedback indicates that some patients are experiencing visual discomfort and are reporting specific difficulties with their current eyewear. A patient present stating, "I can see things up close perfectly fine, but when I try to read signs across the street, everything is blurry and indistinct." Based on your understanding of lens types and their optical effects, which of the following represents the most appropriate initial assessment and recommended action for a certified paraoptometric assistant? Option A. Advise the patient that their current lenses are likely too strong for near vision and suggest they try removing their glasses for distance tasks. Option B. Immediately assume the patient has a new onset of presbyopia and recommend a bifocal or progressive lens evaluation. Option C. Suggest the patient's current lenses are scratched or dirty, as this is the most common cause of blurry vision regardless of distance. Option D. Recognize that blurry distance vision is a common symptom associated with myopia, which is typically corrected with concave minus lenses, and document this observation for the optometrist's review. The correct answer is D. Recognize that blurry distance vision is a common symptom associated with myopia, which is typically corrected with concave minus lenses, and document this observation for the optometrist's review. Explanation. This scenario presents a professional challenge because it requires the certified paraoptometric assistant CPOA to interpret and act upon patient-reported symptoms related to lens performance, which directly impacts patient vision and comfort. Misinterpreting these symptoms or providing incorrect advice can lead to patient dissatisfaction, potential vision impairment, and a breach of professional standards. The CPOA must demonstrate a thorough understanding of how different lens types affect vision and be able to correlate patient complaints with the optical properties of their prescribed lenses. The correct approach involves carefully listening to the patient's description of their visual experience, correlating it with the known optical characteristics of convex plus and concave minus lenses, and then recommending a course of action that aligns with the scope of practice for a CPOA. Specifically, understanding that convex lenses magnify and are used to correct farsightedness, hyperopia, and presbyopia, while concave lenses reduce magnification and are used to correct nearsightedness, myopia, is crucial. When a patient describes difficulty seeing distant objects clearly, this is a hallmark symptom of myopia, which is corrected with concave lenses. Conversely, difficulty with near vision is characteristic of hyperopia or presbyopia, corrected with convex lenses. The CPOA role is to gather this information and present it to the supervising optometrist for diagnosis and prescription adjustment. This adheres to the CPOA responsibility to assist the optometrist in patient care and information gathering, as outlined in the scope of practice guidelines for CPOA, which emphasize supporting the optometrist's diagnostic and therapeutic decisions. An incorrect approach would be to immediately assume the patient's current prescription is incorrect without a thorough assessment of their symptoms in relation to lens types. For instance, if a patient reports blurry distance vision and the CPOA suggests the lenses are too strong for near work, implying a convex lens issue, this is a failure to correctly associate symptoms with the appropriate lens type. This misinterpretation could lead to incorrect advice or unnecessary adjustments. Another incorrect approach would be to offer a definitive diagnosis or prescribe a lens change, as this exceeds the CPOA scope of practice, which is to assist and report, not to independently diagnose or prescribe. This directly violates the regulatory framework that defines the CPOA role as supportive and subordinate to the licensed optometrist. Furthermore, dismissing the patient's symptoms without a proper understanding of how lens aberrations or prescription errors manifest visually is a failure in patient care and professional diligence. Professional decision-making in such situations requires a systematic approach. First, actively listen and gather detailed information about the patient's visual complaints. Second, apply knowledge of optical principles, specifically how convex and concave lenses affect vision, to hypothesize potential causes. Third, consult with the supervising optometrist, presenting the gathered information and potential correlation, allowing the optometrist to make the definitive diagnosis and treatment plan. This process ensures patient safety, adherence to regulatory guidelines, and effective collaboration within the eye care team. Question 16. Stakeholder feedback indicates that patients sometimes describe discomfort or visual disturbances in ways that directly relate to the internal structures of the eye. A patient reports experiencing a sudden onset of floaters and occasional flashes of light in their peripheral vision. Which of the following approaches best reflects the certified paraoptometric assistant's role in managing this situation, considering the anatomy of the globe? Option A. Advise the patient that floaters and flashes are common and usually benign, and suggest they monitor the symptoms. Option B. Document the patient's reported symptoms accurately and inform the optometrist immediately for further evaluation. Option C. Recommend over-the-counter eye drops to alleviate the discomfort associated with the floaters. Option D. Attempt to explain to the patient that the flashes are likely due to age-related changes in the vitreous humor. The correct answer is B. Document the patient's reported symptoms accurately and inform the optometrist immediately for further evaluation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified paraoptometric assistant, CPOA, to interpret and act upon patient-reported symptoms that directly relate to the anatomical structures of the eye. Misinterpreting these symptoms or failing to recognize their potential significance could lead to delayed diagnosis, inappropriate patient management, or even adverse outcomes. The CPOA must balance the need for accurate information gathering with the limitations of their scope of practice, ensuring they do not overstep their professional boundaries while still providing essential support to the optometrist. Correct approach analysis. The correct approach involves carefully listening to the patient's description of their symptoms, correlating these symptoms with the known anatomy and function of the eye's globe structures, and then accurately documenting these observations for the optometrist's review. This approach is correct because it aligns with the CPOA role in patient care, which includes gathering subjective and objective data. Specifically, understanding the sclera, cornea, anterior chamber, iris, pupil, lens, vitreous, retina, and choroid allows the CPOA to mentally map the patient's reported sensations to potential areas of concern. For example, a patient describing a foreign body sensation, or grittiness, might be experiencing issues related to the cornea or anterior chamber. A flashing lights sensation could indicate retinal or choroidal involvement. The CPOA responsibility is to be a precise conduit of information, not a diagnostician. Documenting these findings accurately and comprehensively ensures the optometrist has the necessary details to proceed with a thorough examination and diagnosis. This adheres to the ethical principle of patient advocacy and the professional standard of care for paraoptometric assistants. Incorrect approaches analysis. An approach that involves immediately diagnosing the condition based on the patient's description is incorrect. This fails to recognize the CPOA scope of practice, which prohibits independent diagnosis. Diagnosing requires the expertise and licensure of an optometrist. This approach also bypasses the crucial step of gathering detailed, objective information for the optometrist. Another incorrect approach is to dismiss the patient's symptoms as insignificant or common without further investigation or documentation. This is a failure in patient care and professional responsibility. Even seemingly minor symptoms can be indicative of serious underlying conditions affecting the globe's structures. Failing to document, these could lead to a misdiagnosis or delayed treatment. An approach that involves offering unsolicited medical advice or treatment recommendations is also incorrect. This directly violates the CPOA scope of practice and could lead to patient harm if the advice is inappropriate or incorrect. The CPOA role is to support the optometrist's care plan, not to create one. Professional reasoning. Professionals in this role should employ a systematic approach to patient interaction. This involves active listening, empathetic engagement, and precise information gathering. When presented with patient-reported symptoms related to ocular anatomy, the professional reasoning process should be 1. Identify the reported symptom. 2. Mentally correlate the symptom with the relevant anatomical structures of the globe: sclera, cornea, anterior chamber, iris, pupil, lens, vitreous, retina, choroid. 3. Gather further clarifying subjective and objective information as per established protocols and within the scope of practice. 4. Accurately and objectively document all findings. 5. Present the documented information to the supervising optometrist for their assessment and diagnosis. This process ensures patient safety, adherence to professional standards, and effective collaboration within the eye care team. Question 17. The assessment process reveals a patient presenting with a pale optic disc and significantly attenuated retinal vessels. The Certified Paraoptometric Assistant, CPOA, has been trained to understand the blood supply to the eye, including the role of the ophthalmic artery and central retinal artery. Considering the potential implications of these findings for ocular circulation, which of the following actions best reflects the CPOA professional responsibilities and scope of practice? Option A. Immediately inform the supervising optometrist of the observed pale optic disc and attenuated retinal vessels for prompt evaluation. Option B. Reassure the patient that these findings are common and likely not a cause for concern. Option C. Advise the patient to schedule a follow-up appointment in a few weeks to monitor the situation. Option D. Continue with the remainder of the patient's routine examination and document the findings for the optometrist to review later. The correct answer is A. Immediately inform the supervising optometrist of the observed pale optic disc and attenuated retinal vessels for prompt evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge because a paraoptometric assistant must interpret and act upon clinical findings related to ocular circulation, a critical aspect of eye health. Misinterpreting or miscommunicating these findings could lead to delayed diagnosis or inappropriate management of potentially sight-threatening conditions. The assistant's role is to support the optometrist, and their understanding of the underlying vascular supply is crucial for accurate observation and reporting. Correct approach analysis. The correct approach involves recognizing that a significant reduction in blood flow to the retina, as indicated by a pale optic disc and attenuated vessels, points to a potential compromise of the central retinal artery or its branches. This finding necessitates immediate and direct communication to the supervising optometrist for prompt evaluation and management. This aligns with the CPOA scope of practice, which emphasizes assisting the optometrist in patient care and recognizing significant clinical signs. The ethical imperative is to prioritize patient well-being by ensuring timely professional intervention for any suspected serious condition. Incorrect approach is analysis. Failing to recognize the significance of the pale optic disc and attenuated vessels, and proceeding with routine patient care without reporting it to the optometrist represents a failure to identify a potentially critical clinical sign. This neglects the assistant's responsibility to observe and report, potentially delaying necessary treatment and violating the duty of care to the patient. Documenting the findings without immediate verbal notification to the optometrist is insufficient. While documentation is important, the severity of the observed signs requires immediate clinical attention, which verbal communication ensures. Relying solely on documentation could lead to delays in the optometrist's awareness and subsequent action, again compromising patient care. Suggesting to the patient that the findings are likely benign and will resolve on their own is a significant ethical and professional failure. Paraoptometric assistant is not qualified to make diagnoses or prognoses. Such an action oversteps the scope of practice, misinforms the patient, and could lead to serious harm if the condition is indeed critical. Professional reasoning. When faced with clinical findings that suggest a potential compromise of ocular circulation, a paraoptometric assistant should follow a clear decision-making process. 1. Observe and accurately record the clinical signs. 2. Assess the potential significance of these signs based on their training and understanding of ocular anatomy and physiology. 3. If the signs suggest a serious or urgent condition, immediately and directly communicate these findings to the supervising optometrist. 4. Follow the optometrist's instructions for further action. This process prioritizes patient safety and ensures that critical clinical information is promptly brought to the attention of the licensed practitioner responsible for diagnosis and treatment. Question 18. What factors determine how effectively a patient perceives different levels of brightness and color considering the roles of rods and cones, the process of visual transduction, and the body's ability to adjust to varying light conditions. Option A, the refractive error of the eye and the clarity of the ocular media. Option B, the specific wavelengths of light absorbed by different photopigments within the retinal pigment epithelium. Option C, the differential sensitivity of rods and cones to light intensity and wavelength, the biochemical cascade of phototransduction, and the physiological mechanisms of light and dark adaptation. Option D, the speed at which the brain processes visual information from the optic nerve to the occipital lobe. Correct answer is C, the differential sensitivity of rods and cones to light intensity and wavelength, the biochemical cascade of phototransduction, and the physiological mechanisms of light and dark adaptation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a paraoptometric assistant to accurately assess and explain complex physiological processes related to vision to a patient. Misinformation or an incomplete understanding can lead to patient anxiety, misunderstanding of their condition, and potentially noncompliance with recommended treatments or lifestyle adjustments. The challenge lies in translating scientific concepts into understandable terms while adhering strictly to the scope of practice and regulatory guidelines for a certified paraoptometric assistant, CPOA. Correct approach analysis. The correct approach involves explaining how the different types of photoreceptors, rods and cones, respond to varying light levels and wavelengths, and how this information is processed through visual transduction to create our perception of sight and color. This explanation should also touch upon the mechanisms of light and dark adaptation, detailing how the eyes adjust their sensitivity to different ambient light conditions. This approach is correct because it directly addresses the patient's inquiry by providing a scientifically accurate yet accessible overview of the fundamental physiology of vision, staying within the CPOA educational and informational scope. It empowers the patient with knowledge about their visual system, fostering better understanding and engagement with their eye care. Incorrect approach is analysis. An approach that focuses solely on the chemical reactions within photoreceptors without relating them to the patient's perception of light and color is incorrect. While scientifically accurate, it fails to provide a patient-centered explanation and may overwhelm them with technical jargon, thus not fulfilling the educational objective. An approach that discusses only the process of dark adaptation without mentioning the role of rods and cones in both light and dark conditions, or the function of cones in color vision, is incomplete. This would leave the patient with a partial understanding of how their vision works. An approach that delves into the neurological pathways beyond the photoreceptors and optic nerve, such as the visual cortex, is beyond the scope of a CPOA typical patient education role. While relevant to vision, it ventures into areas typically handled by optometrists or ophthalmologists and could lead to misinterpretation or overstepping professional boundaries. Professional reasoning. Professionals should approach patient education by first understanding the patient's specific question or concern. They should then formulate an explanation that is accurate, relevant to the patient's inquiry, and delivered in clear, understandable language. This explanation must remain within the defined scope of practice for their certification. When in doubt about the depth or breadth of information to provide, it is always best to defer to the supervising optometrist or ophthalmologist. The goal is to enhance patient understanding and compliance, not to provide a comprehensive ophthalmology lecture. Question 19. Examination of the data shows a patient asking for a simplified explanation of how they see. Which of the following descriptions most accurately details the pathway of visual information from the eye to the brain? Option A. Light enters the eye, is focused on the retina, and the signals are sent via the optic nerve to the brainstem for interpretation. Option B. Light enters the eye, is focused on the retina, and then directly travels to the frontal lobe for processing. Option C. Light enters the eye, is focused on the retina, where photoreceptors convert it into electrical signals. These signals travel along the optic nerve, cross at the optic chiasm, continue through the optic tract to the lateral geniculate nucleus LGN of the thalamus, and are then relayed to the primary visual cortex in the occipital lobe for interpretation. Option D. Light enters the eye, is focused on the retina, and the signals are sent directly to the cerebellum for processing. The correct answer is C. Light enters the eye, is focused on the retina, where photoreceptors convert it into electrical signals. These signals travel along the optic nerve, cross at the optic chiasm, continue through the optic tract to the lateral geniculate nucleus, LGN, of the thalamus, and are then relayed to the primary visual cortex in the occipital lobe for interpretation. Explanation. This scenario is professionally challenging because it requires a paraoptometric assistant to accurately recall and apply detailed anatomical and physiological pathways related to vision, a core competency for patient care and education. Misunderstanding or miscommunicating this information can lead to patient confusion, anxiety, and a lack of trust in the professional's expertise. Careful judgment is required to select the most precise and comprehensive description of visual information processing. The correct approach accurately traces the visual pathway from the retina through the optic nerve, optic chiasm, optic tract, lateral geniculate nucleus (LGN) of the thalamus, and finally to the primary visual cortex, V1, in the occipital lobe, with subsequent processing in association areas. This detailed and sequential description aligns with established ophthalmic and neurological principles, ensuring accurate patient education and understanding of how their vision functions. It demonstrates a thorough grasp of the subject matter, which is essential for providing competent care and answering patient inquiries effectively within the scope of practice for a certified paraoptometric assistant. An incorrect approach that omits key structures like the optic chiasm or the LGN fails to provide a complete picture of the visual pathway. This incompleteness can lead to a superficial understanding for the patient and may not adequately address their questions about how visual information is processed and integrated. It suggests a potential gap in knowledge that could impact the quality of patient interaction and education. Another incorrect approach that incorrectly identifies the final destination of visual information, such as stating it goes directly to the frontal lobe for interpretation, is a significant factual error. This demonstrates a fundamental misunderstanding of neuroanatomy and visual processing, which is a serious professional failing. It undermines the credibility of the assistant and could lead to the dissemination of misinformation to patients, potentially causing distress or misinterpretation of their visual symptoms. The professional reasoning process for similar situations involves first identifying the core knowledge required by the question, then systematically evaluating each option against established anatomical and physiological facts relevant to the certified paraoptometric assistant scope of practice. The assistant should prioritize accuracy, completeness, and clarity in their understanding and communication. When in doubt, seeking clarification from a supervisor or referring to approved educational materials is a critical step in ensuring professional competence and patient safety. Question 20. When evaluating the visual experience of a patient who reports difficulty distinguishing between certain colors under different lighting conditions, which property of light waves is most directly relevant to understanding their complaint? Option A. The frequency of the light wave, which is inversely related to wavelength and also determines color. Option B. The polarization of the light wave, which relates to the orientation of the wave's oscillations. Option C. The amplitude of the light wave, which dictates the perceived brightness. Option D. The wavelength of the light wave, which determines the perceived color. Correct answer is C. The amplitude of the light wave, which dictates the perceived brightness. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a paraoptometric assistant to accurately interpret and apply knowledge of light wave properties in a practical clinical setting. Misunderstanding these properties can lead to incorrect patient education, improper equipment selection or use, and ultimately, suboptimal patient care. The challenge lies in translating theoretical concepts into actionable clinical decisions that align with established optometric standards and patient safety. Correct approach analysis. The correct approach involves understanding that light waves exhibit properties such as wavelength, frequency, and amplitude, which directly influence how light interacts with the eye and is perceived. Specifically, wavelength is a primary determinant of color. For instance, shorter wavelengths are perceived as blues and violets, while longer wavelengths are perceived as reds and oranges. This fundamental understanding is crucial for explaining phenomena like color vision, the effects of different light sources, e.g., LED vs. incandescent, and the principles behind optical filters or lenses used to manage light. Regulatory frameworks for paraoptometric assistants emphasize the importance of accurate patient education and assisting the optometrist in providing comprehensive care, which necessitates a solid grasp of these optical principles. Incorrect approaches analysis. An incorrect approach would be to focus solely on the intensity or brightness of light without considering its spectral composition, wavelength. While intensity is a property of light, it does not explain color perception or the differential effects of various light sources on visual comfort or specific conditions. This oversight would lead to incomplete or misleading patient explanations. Another incorrect approach would be to confuse light waves with sound waves, attributing properties like pitch or volume to light, which are irrelevant in this context and demonstrate a fundamental misunderstanding of physics. Furthermore, an approach that dismisses the relevance of light wave properties to everyday vision and optometric practice would be a significant ethical and professional failure, as it undermines the core knowledge base required for effective patient care and support of the optometrist. Professional reasoning. Professionals should approach questions about light wave properties by first identifying the core concept being tested. Then, they should recall the fundamental physical characteristics of light waves and how these characteristics manifest in visual perception and clinical applications. This involves connecting theoretical knowledge to practical scenarios, such as explaining why certain colored filters might be recommended for specific visual complaints, or how different light sources can impact visual tasks. When faced with uncertainty, a paraoptometric assistant should consult reliable, jurisdiction-specific optometric resources or seek clarification from their supervising optometrist, ensuring that all patient interactions and clinical decisions are based on accurate and current information.